Swadee Khan, very good evening and welcome to Thai PBS World Tonight. I'm Nad Bunag.
I'm Tulip Nak Sompoplao, and of course today is the special edition that we will cover all the story related to COVID-19 outbreak, especially the latest one.
Right.
Today, the CCSA has announced that there are new 250 cases, and most of them linked to the gambling ban in Rayong province. And CCSA spokesperson Dr. Thaweesin Wissanuyothin said that the infections in Thailand have surged to 250 cases in a single day today. Of the new cases, only 9 concern arrivals from abroad, with 8 of them in state quarantine and the rest locally acquired cases involving Thais. Dr. Thaweesin said that 198 cases are thought to be linked to illegal gambling activities. These include 108 in Chonburi, 53 in Rayong, 12 in Samut Sakhon, 17 in Nonthaburi, 7 in Chanthaburi, and 1 in Trat, adding that the virus has now spread to 48 provinces. They have gone places.
Right.
According to the initial information, infections among women are twice as frequent as in men, with an average age over 40, and this appears to indicate that the women are more involved in gambling than men, or just only the one that have the outbreak have more women clients than men. The total number of infections in Thailand to date are 6,690, with a total of 4,212 recoveries and 61 deaths.
And in light of the recent outbreak, the Thai government has already announced a ban on public gatherings, citing the risk for the disease transmission, with the exception for household meetings and government activities, and the ban will be effective immediately until further notice. The CCSA spokesman, Dr. Thaweesin Wissanuyothin, said gatherings and activities in government-designated closed surveillance zones and surveillance zones can take place if they receive prior approval from provincial governors. Dr. Thaweesin said that provincial governors are to declare which areas are designated maximum control, closed surveillance, and surveillance zones. They will also set their own policies on quarantines for arrival. Violators will face punishment under Section 18 of the Executive Decree on Public Administration in Emergency Situations. This section carries a jail term of up to 2 years and/or a fine of up to 40,000 baht. As many people are traveling during the New Year break, Dr. Thaweesin advised them to check before their journey to make sure their destinations do not require visitors to be quarantined. Meanwhile, the Civil Aviation Authority of Thailand has issued an announcement effective from Thursday until further notice, banning food and drinks on all domestic flights in the wake of the new COVID-19 outbreak. However, the cabin crew may serve drinking water to passengers in case of emergency or as necessary, but the service must be separate from other passengers. Magazines, newspapers, and pamphlets will also not be allowed on board except for safety manuals.
So in light of all those infections, beside the gathering ban, some provinces also have some kind of semi-lockdown, especially in Chonburi and in Banglamung area and Pattaya area. The governor just announced this morning, the governor Phakkaphon Thienchai said that this Pattaya and Banglamung are now classified as highly controlled areas with an emergency order, shutting down bars, parks, schools, and non-essential businesses. There are no set curfews, no checkpoints or travel restrictions, but the governor is urging people to stay at home. The order also does not ban alcohol sales, but large parties and gatherings, even at private homes, are banned, though they didn't say what is the maximum number of people get together. The businesses ordered to be closed are bars, nightclubs, karaoke bars, massage parlors, cinemas, internet cafes, and other service and entertainment and leisure venues, shopping malls and stores selling non-essential items, schools and other education-related places like nurseries, child care center, and learning center. The closure also covers gyms, public pools, public parks, and other fitness-related places. However, the restaurants are allowed to open for takeaway orders only, while hotel restaurants can remain open for dine-in, but for the guests that's staying at the hotel only. Businesses that are considered essential can remain open, such as supermarkets, convenience stores, drugstores, banks, hardware and construction stores, and mobile phone stores. But the 24 hours convenience stores must close from 10 p.m. to 5 a.m.
So that's the latest measures taken in Pattaya and Banglamung. Right. And today, the cabinet has approved a relief budget to fight the COVID-19 pandemic. The cabinet has approved an 11 billion baht budget to fund the procurement of medical equipment, vaccines, and medicines to fight the COVID-19 pandemic and to compensate about 1 million public health volunteers for 3 months from January to March next year. Deputy Government Spokesperson Ratchada Thanadurek said today that about 4.3 billion baht of the 11 billion will be used to implement 5 projects, namely risk compensation for about 1 million public health volunteers estimated at 1.5 billion baht, 503 million for the procurement of medical equipment, medicines, and laboratories to fight the contagion, 1.8 billion for COVID-19 vaccines, 24 million for the development of laboratories for COVID-19 testing, and 419 million baht to make other preparations to cope with the pandemic. And about 6.9 billion baht of the 11 billion will be allocated for the treatment of infected people. She also said that the money is enough to meet the immediate demand and the spending can be checked and examined to ensure transparency and accountability.
And also the problem of illegal worker that we have said that it is a big elephant in the room. No one has really addressed it often enough. But today the cabinet has resolved to allow the illegal workers from Laos, Cambodia, and Myanmar to stay and work in Thailand after they are documented. So illegal migrant workers from these 3 countries and their dependents under 18 who are currently in Thailand will be able to stay and work legally with health coverage for up to 2 years as a special case approved by the Thai cabinet. The exemption from arrest and prosecution was proposed by the Ministry of Labor as part of the effort to curb the spread of COVID-19, an outbreak of which was allegedly triggered by some infected illegal migrants from Myanmar working at the Central Shrimp Market in Thailand's province of Samut Sakhon. Illegal migrant workers who are not yet employed and their dependents under 18 will also be covered by this special arrangement, designed to encourage them to come forward instead of hiding, which will make it difficult for Thai health officials to contain the virus. It is also intended to stop employers abandoning the illegal workers in an effort to escape prosecution. If you remember, I think the beginning of the week, there were some news that some employers in Samut Sakhon just come somehow sneak out of Samut Sakhon area and just leave numbers of Myanmar workers there for the police to find and just arrest them. So this is part of the solution that hopefully will help fix that problem. So under this arrangement, employers who have hired illegal migrants are required to bring their employees for registration with the authorities by February 13. Those who are unemployed are required to report to the Employment Department of the Labor Ministry from January 15 to February 13 for formal documentation. Both unemployed and employed illegal migrants must be screened for COVID-19 and other diseases as specified by the Public Health Ministry. Both groups will be given health coverage for 2 years. I think this is a pretty good deal. Thai employers who want to hire the unemployed who have gone through the registration and health screening process can do so by applying to the Employment Department by September 2021. So you have 9 months, more than 9 months. Children of the migrant workers who are at least 15 years of age can work in Thailand if employers are willing to employ them and seek permission from the Employment Department on behalf of the underage workers.
And normally at this time of the year, many people would travel back to their hometown, usually by bus or trains. But this year, however, the number of passengers have reduced by almost a half. So this is something that is not really usual compared to previous years where you would see tons of people at bus stations and train stations as well. And recently, the Bangkok bus terminal, widely known as Mochit 2, is seeing few passengers traveling back home this year. The interprovincial bus company, the Transport Co., revealed that the number of passengers has fallen by 30% compared to the same period last year. Around 52,200 passengers took interprovincial bus services yesterday, which is fewer than the estimated 70,000 to 80,000. The Transport Co. estimated, however, that 90,000 to 100,000 passengers will use bus services today. One of the ticket agents at the bus terminal said that many people have surrendered their tickets for refunds, as most of them are not only afraid of contracting the virus, but also said that a nationwide lockdown will be imposed. A lot of people have canceled their planned journeys since December 1st, with an estimated loss of revenue of around 4.6 million baht. Meanwhile, the Department of Rail Transport revealed that the volume of rail passengers has almost halved since the recent outbreak of COVID-19. And yesterday, around 703,000 passengers took trains nationwide, which is a lot fewer compared to the 1.2 million passengers on December 18th, which was just before the new outbreak began in Samut Sakhon. The DRT Deputy Director General said the rail transport operators have been instructed to impose measures to prevent the virus from spreading, such as cleaning trains and stations regularly, as well as asking passengers to wear face masks, refrain from talking, and use hand sanitizing gels.
Now, talking about the effect of COVID-19, it's not just Thailand, it's around the world. And people starting to looking forward to 2021 since months ago because they just want this year to be over.
Yes.
And just this week, the Economist Intelligence Unit, The Economist is a very, I would say, well-known economy magazine that do a lot of analysis and opinion pieces on world economy. But they just published a report and said that there are plenty of things to be worried about beyond COVID-19. They said that the political instability has been worsened by COVID-19 and will continue to be a threat in many countries. So it sounds so familiar. It's not just Thailand that's facing this turmoil between the politics and COVID-19. It's a lot of countries is facing that. Divergent recovery speeds, differing policy responses, global supply chain readjustments, and ever-present political instability create an enormously challenging global business environment. That's what the 2021 Outlook report by the Economist Intelligence Unit, or EIU, said. The report published this week said that there is a long tail of country risk, though not directly related to COVID-19, but mainly exacerbated by the outbreak. EIU predicts that the world growth this year will be minus 4.7%, of course. Next year will be better at 4.2% and 3.2% in 2022. The forecast is based on multiple factors: fiscal space and commitment, monetary policy and flexibility, sectorial composition, severity and timing of lockdown measures, export market exposure, and labor market dynamics and demographics. The economic experts stated that there are key issues to watch at a country level in 2021. However, there are other recurring themes that will shape the growth outlook and the business environment in the coming years. First, the global trade and supply chains are being reshaped. Countries are striving to diversify their export markets and jostling to capture redirected manufacturing investment, while companies are concurrently seeking to diversify their supply chains. Political instability continues to be a threat in many countries. Joblessness, poverty levels, and rising inequality have only been worsened by COVID-19. Many countries are newly prioritizing substantial investment in infrastructure. This investment will be pursued to facilitate job creation and in some cases to try to keep the potential for social unrest at bay.
And that is a lot to worry about beyond COVID-19,
Yes.
as according to the report by the EIU here. And speaking of COVID-19, because the outbreak is still going on, we will give you a recap of what are the symptoms of COVID-19, and probably it's something to double check if you may have these symptoms or you've been to these places at risk. So the most common symptoms you're seeing right here is if you have a fever, a dry cough, or tiredness, and the less common symptoms include aches and pains, sore throat, diarrhea, conjunctivitis, headache, and most importantly, the loss of taste or smell. And this also includes a rash on your skin or discoloration on your fingers or toes. And the more serious symptoms of COVID-19 is difficulty breathing or shortness of breath, chest pain or pressure, loss of speech or movement. On average, it takes around 5 to 6 days from when someone is infected with the virus for symptoms to show. However, these symptoms can take up to 14 days. So to double check if you have these symptoms, we're showing you right here on the screen. And if you feel that you have the symptoms, go to the hospital and get tested.
So the first three, the fever, dry cough, and tiredness might not be that obvious, but if you lost sense of smell or taste, that is pretty obvious. It becomes something that medical personnel and many governments have been trying to warn people. This is one of the becoming more alarming symptoms lately.
Yes, and these are the common symptoms that you might see for the COVID-19, and maybe you can use these guidelines to check yourself if you might think that you get the virus already. So just if you do feel that you have the symptoms, just get tested as soon as possible. And that wraps up tonight's edition of Thai PBS World Tonight. Thank you for watching and Happy New Year in advance. สวัสดีค่ะ
สวัสดีค่ะ